Over the course of the pandemic, healthcare workers have been on overdrive, but there is another problem plaguing emergency rooms and hospitals. KRQE News 13 investigative reporter Gabrielle Burkhardt exposes healthcare workers dealing with an epidemic of violent patients.
We got requested up by city security for an intoxicated individual.
It's a problem EMS crews, healthcare staff,
It's a very rewarding profession, but there's a dark side for sure.
and law enforcement across New Mexico
I'm here at least twice a week or twice a day.
are all too familiar with. Video from Albuquerque police in May shows officers responding to Loveless Hospital in downtown Albuquerque.
I hit my partner on the side of the head, and then she kicked down and she kicked me over here on the left flank.
Paramedics say they were kicked and hit by this woman, 39-year-old Ana Olivas.
Can I ask you where I'm at?
Hospital staff say she was drunk, refusing to leave after being discharged.
Is that the time she kicked her in the chest? Yeah.
Security tells police Olivas was screaming at nurses, trying to bite, kick, and hit them even after security officers handcuffed her.
So at this time you are under arrest for battery on a healthcare member?
Olivas' criminal history includes battery on police officers and drunk driving, cases that were pending when this happened.
The emergency room and the ICU are the top areas where abuse occurs, but that's occurring more and more on the med-surg floors.
Gloria Doherty is a PhD nurse practitioner and president of the New Mexico Nurses Association.
Is this a dangerous profession?
I would have to answer yes, and that breaks my heart because I wouldn't do anything else in the world.
A recent National Nurses United survey found nurses reported 22% more violent occurrences during the pandemic, and Doherty says those are just the cases that get reported.
Well, we were here yesterday for another one that was kicking the nurses, but the nurse didn't want to press charges. She didn't want to come in and do the court and stuff.
You have angry family members, you have angry patients, you have just the systems that are broken with understaffing.
Alcoholism, drug abuse, and mental illness also pose a big problem in New Mexico, Doherty says. In March, police took this report from Presbyterian Casement Hospital in Northeast Albuquerque.
Yeah, this gentleman here comes in, he has a history of psych problems in the past, history of methamphetamine abuse.
A nurse practitioner is describing Tyler Shropshire. Staff is very familiar with the 31-year-old.
He actually struck one of our staff 2 months ago, inpatient here, punched her in the face.
When Shropshire didn't get the meds he demanded,
And then he stood up, punched me square in the face.
staff in this case decided to press charges, but even that isn't always easy for healthcare workers.
The culture of most organizations is this is just part of the job, and it's really not okay.
Battery on a healthcare worker is a fourth-degree felony.
You can see this Alamogordo nurse struggle with the decision to press charges in June. Even after a woman punched her and hit other nurses' aides.
You can't do this to people, I know.
Hospital workers know a short jail stay won't fix everyone's problem. Take Renisha Kale's case.
What did you do? He said I hit some.
Loveless Women's staff say she came in and started swinging at nurses. Kale also has a long history of assaulting healthcare workers. She tells officers she's homeless and struggles with drugs and alcohol.
But I'd rather go into the streets where, I don't feel safe, but I'm free.
In lots of these cases, the officers tell healthcare workers the offender will likely be back on the streets soon. So what's the solution? Doherty gave us a breakdown of what the New Mexico Nurses Association would like to see.
She says New Mexico needs more behavioral health providers and support. Nurses need better training and de-escalation. All hospitals should adopt zero-tolerance policies for violence with security checkpoints for visitors. She'd also like to see more follow-through in reporting violence from the front lines to the justice system and for people to get the help they need.
30 years later, I still love what I do. I go home every day feeling rewarded for making those difference, but you do have those circumstances. There's probably not one night that I'm not admitting somebody who has the potential for danger.
Gabrielle Burkhardt, KRQE Investigates.
Albuquerque police logged thousands of calls to hospitals alone over the last couple of years. As you heard in that report, battery on a healthcare worker is a fourth-degree felony here in New Mexico. But what happens to those cases in the court system?
He is in the wind, not reporting to pretrial services. That's right.
Investigative reporter Gabrielle Burkhart talks to prosecutors and defense attorneys and brings you the status of the cases you just saw in part 2 of this story. That's tomorrow night at 5:30 on KRQE News 13.